Afternoon. My name is Festus, spine injury patient, and I thank God for the fact that He has taken me. Today, I have something that I want to speak so that people may know how most of the people who are suffering from spine injury issues, what they undergo. One of the things that I'm going to speak today is about how do they go for a short call. Later, not today, I'm going also to show you how these people that are suffering go for a long call. But today I want to specifically speak about the short call. Most of the people who are suffering from spine injury, they have so many complications. Most of the things they don't do normally. Even going for short call, kuenda kukojoa, that is what I mean. Inakuwa there is a process that they undergo. And that is why you will find most of them, they move around with the urine bag. You cannot see them because they are always hidden on their bellies. There are different type of urine bags. There are also some that are tied on the leg. But it is advisable for people to know out there, what do these people actually undergo? Today I want to specifically speak about usage of catheters. There are different types of catheters, and major three types of catheters. They are called urinary catheters because also the systems that they use also to induce medicine in patients. There are some called catheters, but I want to specifically speak about urinary catheters that help people with the spine issues to be able to drain their bladders. First and foremost, the first type of catheter that is very common, you will always see it in the hospital when patients are admitted, is indwelling catheter, Foley or Foley catheter. Those catheters are semi-permanent because they are put inside the bladder of a patient through urethra all the way to the bladder so that they may be able to drain the urine. Most of the people that are suffering from these issues, they are prepared to be able to go for a short call through usage of indwelling catheter, especially for those who are admitted in hospitals, and also most of the patients that are suffering from spine injury with either paraplegia or quadriplegia. Quadriplegia, those are the people that are suffering, maybe they were hit above the arms, so their arms are not working, their feet are not, the lower limbs are not working, they are completely not working. Such people, most of them use indwelling catheter or Foley catheter. It has a balloon. Once it is inserted through urethra into the bladder, there is a balloon that is always inflated so that it can be able to hold and the catheter cannot come out. The second one is intermittent catheter. Intermittent catheter, it is used especially when a person, the urethra of that person is a bit tight. It doesn't release urine even when the bladder is full of the urine, and that urine is not coming out. Most of them, they are advised to use intermittent catheter. This is an intermittent catheter. It is always used especially to help the people to relieve themselves. And this is only for the people who are paraplegia, the people whose hands are working. The upper part of the body is working, they are okay, but the limbs are not working. So, the third one I want to speak about is the condom catheter. It is called external, but most of the people they use as condom catheter. It is just like a condom. It is used especially for the patients who are suffering from spinal injuries, and their bladders, they release urine. Even if the bladder is not full, you see the valve that closes the bladder so that the urine cannot flow through the urethra, it is weak. And so you find those people, even when they are walking, you can see somebody has already urinated for himself. So this is what I wanted to say. These things are actually these are the things that these people usually go through. And it is advisable for the people outside there to know it is not a walk in the park. Maybe somebody went to the hospital and he came out, and because of what he is suffering from, there are so many things that he does that the people outside there does not know. And it is always good for to educate people about what goes on. And that is why you hear this is a very expensive affair. It is a very expensive lifestyle to live with a person who is actually suffering from spine injury. On the indwelling, about the indwelling catheter, there are two specific indwelling catheters. One is put through the urinary canal all the way to the bladder. The next one, it is called suprapubic catheter. It entails a patient undergoing a surgical process just here below the stomach, near where between almost close to the pelvic. That person undergoes a surgery, and so a catheter is placed through this part of the body. And that happens especially for the patients that they have either infections in the urinary canal or the urinary route, or they have complications that when the indwelling catheter it is put through, or it is inserted through the urinary, you find that it goes and blocks, and so there is no urine comes out. So such patients, they always undergo that surgical process, and they are given that suprapubic catheters. Okay, let me speak about and show you demonstrations about how intermittent catheters work, because now in my case I use intermittent catheter. God is so faithful to me. I don't move around with the urine bags like this one. I don't move around with the urine bags. But if I had an indwelling catheter, it means that I must walk around with a urine bag. Number one, there are several things that you're supposed to do. This urine bag, it is supposed to be used only once. According to doctors, according to manufacturer, this urine bag is supposed to be used only once. But because of the setup in African nature, we cannot afford, and our medical systems, this SHA and everything, we cannot afford to use this urine bag once. Even in our hospitals, even in Aga Khan where I was admitted, they were not using once. Why? It is because of the cost implication. This urine bag, it has a valve, and here the manufacturer has given caution for single use only. Discard after use. Do not use it if the package is open or damaged, because it is sterile. So it is very important for us to understand that. Number two, you need this Now this is what is called intermittent catheter. This one. It comes with the sizes 14, sizes 16, depending with the breadth of the wind. I don't know whether it's the breadth of the wind, depending with your urethra size. So size 14, this is size 14. It has this green mark, this one. This green mark here, this is the mark or the trademark that shows it is size 14. For size 16 that I used once, it is in pink in color. This intermittent catheter, they are of two types. The best type, and it is very expensive, it is called silicone intermittent catheter. But this one is a bit cheap, and it is also supposed to be used once. But because of the cost implication, I believe the whole of Africa, it is not possible. There are very few people. There are very few people who can afford to have these things and do them in their homes. So this intermittent catheter is the one that I'm using. It is PVC. PVC is a bit cheap, but the best and the most recommended is the silicone intermittent catheter. And even in dwelling catheters, silicone is the best, because it is said that the silicone, you can stay with it in your body even for 2 months. But for the PVC, maximum is 14 days. So what is the difference? Why did I choose to use PVC instead of a silicone catheter? Number one, if here at the tip there are some holes, these holes are the ones, once it enters into your body, these are the holes that sucks out the urine, and it drains into this urine bag. Here there are small holes, but for the this is for the PVC, but for the silicone the holes are a bit bigger. They are a bit bigger, and by virtue of being bigger, it means the moment that you have drained the urine and now you are pushing it out so that you may be able to clean it. In most cases, it was injuring my valve, my urinary valve, and that is why I decided to go for this. So what other things that are required? You need also to have this gel. It is called KLY. This is KLY. It goes for 300 shillings, and I usually use it for 2 to 3 weeks. 300 shillings. Why do you use this gel? This gel is recommended, and in most cases it is called KLY, lubricating jelly. It's to lubricate this one, so that the moment that you start to insert through your manhood, through the manhood or the penis, all the way into the urethra, it is supposed to be slippery. If it is not going to be slippery, it is going to injure you, and in most cases it will cause infections along the root. And also the most vulnerable, it is that valve, because it is as if you are trying to push. So if it is going to be dry, you are going to injure yourself, and that is why we use this gel. There is another thing that is very important for every person who is suffering for this for spine injury. There are some medication that you have to take, and that medication, I chose this one because this is an original medicine. It is called the Roxiclot. This is the one that I was using when I was at Aga Khan. This is the best in town, and I decided to maintain it. I usually go to send my friends and my wife, they go and buy for me Rivaro Sabin tablets. You take one per day. This is a blood thinner. Blood thinner is very important because every person suffering from these spine injury issues, you find yourself, you are either sleeping or sitting down the whole day. You cannot stand, you cannot walk, you cannot do anything. So they are very important to make sure that even if you sit down for a long time, blood clot is not going to happen. This is the importance. You take one tablet every day. And I told you this is a very it is a very expensive affair. I take these tablets every day. One tablet is about 40 shillings. So every month I must have 1,200 shillings to buy these medicines. I need to buy these one. These intermittent, they go for depending with where you are going to buy. It goes from 200 to 300 shillings. This one I've told you, it goes for around 300 shillings. This one, I have some, I was told it is about 130 shillings. So, being a very expensive affair, you need to be always careful. And they look for all means to make sure that the people that are taking care of you, they provide these things. How do you use a urine bag? I told you this thing is sterile, and that is why it is sealed. Every time that you want to use it, you just unseal it. Then this one is about 200 ml. Every time that you want to use it, this is what you usually do. You open this place. This urine bag is it has kind of a vacuum inside, because the urine that is inside it, unless you open the cork and the valve, there is no way you can drain it. Even if this side you forget and you leave it open and the urine bag is full, it can never drain. So you just take this one, you clean it with clean water, then you make sure you rinse it completely. You apply this KLY gel. After applying, you fix it at this point, and now you prepare yourself, you hold your manual, and then you insert it gently. This intermittent catheter is roughly 40 centimeters. More than 3/4 of this catheter will disappear into your body. More than 3/4 of it is going to disappear, because it will just leave a very small size. Yeah, and that is how this thing is being used. So every time you see these patients out there, I just beg that you sympathize with them, because there are so many things that they go. Saying is this: every time you see a person on a wheelchair, my wheelchair is here. This is what makes my mobility a bit easier when I'm in the house, when I'm going outside. So the moment that you see these people outside there, please sympathize with them, because what goes behind the curtain, it is not easy. Money is needed to help these people. They need to have this medication, they need to have this gel, they need to have these catheters, they need a lot of things here and there. My cameraman has asked me a question. How do I know, or how will you know when now this intermittent catheter has reached inside the bladder? Number one, I've told you it is about 40 centimeters, and more than 3/4 will disappear into the body. And in most cases, because you are putting it gently, it will reach at a place where you'll hear a bit of hardness, and when you press just gently, you will hear it has passed that something that it's kind of a bumpy. It is kind of a bumpy situation. The moment that you hear that bumpy, hold on, and you will see urine coming out. One of the major things that you need to do is to understand cleanliness of this thing is very, very essential. You usually store it in clean water. You don't just clean it and leave it in open space. No. You clean it, you have a bottle full of water, and then you dip it into the water. In most cases where maybe, the water is not, you don't have somebody to change for you water now and then, you can use Dettol, a bit of Dettol, so that water can stay to about maximum of 2 days, maximum of 48 hours. Why? You need to be very, very careful, because now you are fighting against getting infection. And that was my presentation today about catheters. The other things that you need tissue. You need also, in most cases, you need to have these antibacterial wipes. Why? Because now, after finishing doing your procedure, you need to clean your hands. Most of us, we are not in a place where we can rush to the sink, we can rush to where there is a water sources. So that is exactly what I was encouraging people to understand and to know, what people with these challenges, what they undergo. So this is a lot of money, but God is gracious. If you see these people outside there, if you have any capacity, please assist them. Assist them. There are so many things. I'm going to speak now about the long haul. Nimeongea kuhusu kukojoa, nitaenda kuongea kuhusu kuenda choo sasa. That is now hectic for people suffering from spine injury. This is just for education purposes. God bless you. Bless these people when you see them, and God is going to do something on you. Thank you. God bless you.